Hi, I'm Gail McGuire. I've been teaching ethics and jurisprudence since 2007 in complementary and alternative medicine specifically. And today I wanted to do a little talk about some of the most common documentation errors that we see in our fields. I will keep the specifics of acupuncture, naturopathic medicine, those specific details out, and they very much can vary depending on what jurisdiction you're in. But common mistakes that we see overall in healthcare. The first few would be specific to electronic charting. The note bloat would be the first one. Note bloat is really common with copying and pasting from our electronic files. So it's really easy to copy, paste a whole section from one note, one chart to another within the same patient file. And that can come with a lot of extra information that doesn't need to be in each and every appointment. And the risk of that, well, one of the risks of that is that we may dilute some of the important information, or it may just certainly be not relevant for that appointment. So then it's erroneous information that shouldn't be there. So there's a few reasons why we should avoid the note bloat. The second easy one with electronic charting is the pre-chart. Might be something that you find really helpful to speed up your day, to get ahead of some patient files, but putting information into a chart before the patient has arrived can get you into trouble. And it's not hard to verify that with electronic charting. It's not hard to see the timestamps on these things. So if you've entered something and you've maybe even entered most of that chart before you've seen that patient, same goes with insurance. These are things that can get you into trouble if, and it's easy to find out if there has been some erroneous charting that was done when it shouldn't have been done. And again, same with insurance. We can also see it really easy to happen that you simply are documenting your electronic charts in the wrong person. With a click of a button or the touch of a mouse pad or the accidental swipe with your finger on a mouse pad, really easy to end up loading the wrong patient file in front of you on that computer screen. So we do have to be really cognizant of have I entered this chart information on the right chart. So always make sure as soon as you're about to start, am I actually on the right chart that I think I am? And again, crazy things can happen with just the swipe of a hand unintentionally. Another one that we see quite a lot with the digital information these days and the technology is simply a transcription error or a speech recognition error. So if you are using those kind of techniques for your documenting, be careful again about doing things too quickly, doing things without actually reading it as in depth as you need to be. Remember that these things are your legal documents. We want them to be impeccable as much as we can. Remember that good charting really protects you. Obviously, they're a patient record. It is meant for patients' use and for tracking their treatments. But in a lot of ways, it should be something that also shows everything that you did and can protect you if worst came to worst. Regardless of whether you're using electronic or paper files, late entries. Late entries can also be something that can get you into trouble. There's nothing wrong with adding information after a chart has been signed off or closed on your electronic charts. We just need to document that. We need to specify that that entry was made a little bit later. So if you've written the whole template or you've written the whole SOAP form or what have you, you've finished off all the sections and you've signed it either manually or electronically. If you go in and you realize that you've missed some information or something happened, maybe as the patient was leaving your office and it was kind of added information that you'd like to have, no problem with adding that. We do just have to acknowledge that it's a late entry, put your date, your time, and sign it again. Some of the really common things that I see with my students and when I was doing audits for the competency regulator committee, we would see a few issues with just how a chart was presented overall to a patient. And then it makes you wonder if the patient, or sorry, the clinician actually did everything that they should be doing. Oftentimes, I can assume that they just simply forgot to write it down. But of course, again, something that is going to protect you and end up being your legal record, you want it to be as thorough as possible. So, follow up, as simple as making your follow up notes What have you told the patient to do? What did you do in that appointment? We know, again, this may vary again depending on your jurisdiction, but there may be specifics of what you need to document. If you are using acupuncture needles, how much detail does your regulator or association require? Do they need to know the depth of your needles, the angulation, the whether they're bilateral or not? Do you need all that detail? Generally speaking, if you're not sure, more detail is better. However, if you're using herbs, if you're using vitamins, if you're using lifestyle advice, all these things that, assuming that they're in your scope and you're allowed to prescribe them, document that all. With herbs and patents, make sure that you are very specific down to the detail of how many milligrams if you need to be. If you think about this and compare this to pharmaceuticals, a pharmacist has to dispense a certain amount and they have to be explicitly clear how many times a day are you using this for how many days. So the dose and duration. You can imagine that this is an area where patients might really enjoy the herbal patent or formula that you gave them, and maybe they got some unintended side benefits from it. Maybe they started losing weight and you only told them to take it for a week, but they ended up taking it for 6 months and now they're in liver failure. You want to be able to prove that you told them to take it only for 1 week. So be really clear on all those details, right down to, again, thinking of yourself almost as a pharmacist where you need to write down all of those things. You may even go so far as to transcribe. If you're using some sort of formula, you may want to transcribe exactly what those ingredients are and how many milligrams are at the time that you recommended it. We all know that formulas can change somewhat. Some of these vitamins and nutraceuticals in particular, the formulas can change, and it might be in your best interest to even document exactly what's in that or attach a screenshot of the ingredients in that product that you recommended at the time. But as far as follow-up goes, do make sure that you've told a patient what you expect for follow-up and when you expect to see them, and how long they should book their appointment for, and try to give them a good forward-facing plan as well. We know that patients come in for our expertise, and we shouldn't be shy about giving them a long-term projection as far as what this looks like. So you've got a sore shoulder. I want to see you once a week for 6 weeks. You've got perimenopause. This stuff takes some time. We're going to need to see you for 3 months. I'm going to probably see you every couple of weeks in between, but do make sure that your follow-up is really clear. And with that, I suppose I would also add a final note on that, to make sure that they know that they can change things if they need to, that they have the ability to withdraw consent, that they should let you know if there's something bothering them, or have you given them instructions, if anything bothers you, or if this vitamin bugs you, drop down the dosage or call me. What would those kind of instructions like? So make sure you document all of that. We also want to make sure that patients understand our rationale. So have we provided reasoning within our SOAP notes or whatever template you're using for what we've prescribed? Make sure that your reasoning, your assessment is thorough enough, and perhaps within your plan section, your actual prescription part, I'm prescribing this formula for this reason, for this long, etc. In general, there's a few things that can come up as well for just, I think maybe just the way that we write sometimes. Sometimes we get a little sloppy. Sometimes our language is a little bit vague. So if our handwriting is unreadable, that's a problem. If our terms and our assessments are vague, that's a problem. So we want to be able to, again, keep this safe for the patients, keep ourselves out of trouble. We want to make sure that there is no vague language in our charts, especially when it comes to objective findings, saying that a patient's complexion is good, that their blood pressure was normal. We want to be explicitly clear. If we've got a value or a number that we can measure or objectively observe and write down, that's what we want to use. And then finally on there is abbreviations. We do have plenty of commonly used medical abbreviations. If there's any doubt, you should create a legend at the first time that you use it or at the start of your chart. Some of these electronic charting formulas do allow you to put that as a recurring memo at the top. If you are not sure, and if it's one of these abbreviations that you've made for yourself, you definitely have to identify that or have some sort of legend within your chart. We do always, these are very basic things, but we do always need to make sure, always, that we have consent from the patient. Most regulated areas and jurisdictions will require that to be in writing. And we do want to always honor privacy as well. The way I explain this to my students is that essentially no one should know who your patients are. They could be sitting beside each other in the waiting room and not know